the number of teenagers and young adults coming to me with an actual suicide date, a
Wow.
date.
Well, just
This is
ask,
it.
just as a personal thing, what do you feel in your heart when somebody comes with that? That's
Yeah,
so hard for a therapist and for a
yeah,
practitioner. Actually, I was actually discussing, I was my supervision call this week. I work with a psychologist, PhD, every week. He
yeah,
says, "Excuse me," he says, "Excuse me, Mandy, I have a suicide phone call coming in, which I have to take." So I asked him the same question. And like I always like to ask from every practitioner,
yeah.
like that's one of the most hardest things in the responsibility and what do we really and actually this I was discussing it. I don't know if you know, my wife told me and asked her the same question, and we always get involved the psychiatrist, but it's one of the hardest things for a practitioner to face,
Yeah.
how to deal with that.
And that's why what's so important, because so many of them that came to me with that suicide date, they'd already been 5150. They'd already been in psych wards. They'd already been in treatment centers. They'd already been to rehabs. They'd already been to eating disorder clinics. All of that reacting to the suicidality had been there for years. And SRT, not being in a therapeutic model, has an entirely different approach. We do have that choice. And I just feel so privileged to have an opportunity to work with you because they'll say, this is my last, I've tried everything else. If this doesn't work, this is my date, right? This is how I'm going to do it. So there it is. Well, this is why SRT, what's so important, and it's even in our handouts in module 3, the because people want to know, well, how is this approach different than other approaches? And one of the really important ways that our approach is different than all the others is that it offers immediate relief. Immediate relief. So they experience right away that we're not like any other approach. I'm not doing any history taking. I'm not asking you any questions. You don't have to tell me anything about, right? They're taken so outside the therapeutic model that it gives them so much hope. It is love and humanity, right? Because again, remember with SRT, when you're outside that therapeutic model, what they're experiencing right away is there is no pedestal, there's no therapist here, and you're here coming for help. It's I'm a human, you're a human.